Hi, I'm Mark Barbie. I'm one of the instructors and owners at AZ ACLS. If you need to recertify in ACLS, BLS, and PALS, our instructors have decades of experience and we won't waste your time. If you're ready to book a class, click on our website. Hi, I'm Mark with AZ ACLS. We're going to talk about CPR for healthcare providers, also known as basic life support or BLS. We have three categories in CPR: infants, children, and adults. Infants are under 1, children are greater than 1, but not yet through puberty, and adults are puberty on up. We say it that way because our 13, 14, and 15-year-olds look like they're 18, 19, and 20. So if they look like an adult, they're an adult. If they look like a child, they're a child. CPR will always be 30 to 2 across the board. That's 30 compressions to 2 breaths for a single rescuer, whether it's an infant, child, or adult. If you have 2 rescuers and you're working an infant or a child, you'll switch to 15 to 2. But adults will stay 30 to 2, 1 or 2 rescuers. Remember that CPR is always done on a firm, flat surface. It'll never be done on a couch, on a bed, on an exam table. The best place to do CPR will always be the ground. So because you're all healthcare providers, you do a different kind of CPR. So the numbers we talked about, I want you to forget about for just a second. For you, you're going to be doing continuous chest compressions. That means no positive pressure ventilation at all, ever. Your requirements are your patient has to be 8 years old or older, you suspect a heart attack, also known as an MI, or you don't know why they're dead, but they're dead. So I'll repeat that again. Your patient's 8 years old or older, you suspect an MI, a heart attack, or you don't know why they're dead, but they're dead. If that's the case, you will be doing 200 compression CPR or 2 minutes. If you're in hospital, you'll go by time. If you're out of hospital, you're going to count your repetitions. And it's 4 rounds, so 800 compressions or 8 minutes. Reassess pulse and breathing, start over. No positive pressure ventilation at all, ever, only passive oxygenation. So that could be a non-rebreather mask, that could be a bag valve mask hooked up to 15 liters with no positive pressure ventilation. So the other things we need to consider is if your patient is under 8 years old, they should always be 30 to 2 one person or 15 to 2 two person, no matter what. So it doesn't matter why they're pulseless and apneic. They should always be 30 to 2 one person or 15 to 2 two person. But several years ago, they rewrote that rule to protect you and I when we're not in a clinical environment. And it says, if you're unwilling to put your mouth on the child who's under 8, then just do 200 or 2-minute CPR. You don't have to feel like I do, but I won't put my mouth on anybody unless it's my wife or kids. And the likelihood of you carrying a pocket mask or a bag valve mask with you 24/7, 365 is slim to none. So if you come across a situation where you have somebody who's under 8 years old and this is not your child, you can do 200 compression or 2-minute CPR until a family member becomes available or some kind of airway adjunct like a pocket mask or bag valve mask. Then immediately stop what you're doing and switch to 30 to 2 one person or 15 to 2 two person.
No heartbeat. Finally a chance to use my online CPR training. Lisa has a boyfriend. Lisa has a boyfriend.
The last group we need to talk about is when they're over 8 years old and you know why they're dead or pulseless and apneic. So some examples would be trauma, so they're disfigured or bleeding. You witness respiratory arrest lead to cardiac arrest. You see pills. You see alcohol. They're wet like they're pulled from water. What I'm trying to describe to you is somebody who's over the age of 8. You walk into a situation at the blink of an eye, you know why they're pulseless and apneic. If that's the case, and you're a single rescuer, you should be doing 30 to 2, 5 times, reassess, start over. If you have 2 rescuers and you're dealing with a child over the age of 8, you should be doing 15 to 2, 5 times, reassess, start over. If you're a healthcare provider, you have to mix up your 30 to 2, 15 to 2, 200 and 2 minutes. So let's review. If you're a single rescuer and you're by yourself, it is 30 compressions to 2 breaths across the board. If you have an infant or child and you have 2 rescuers, you should be doing 15 to 2. But adults will always stay 30 to 2, 1 or 2 rescuers. If you're a healthcare provider and your patient's over the age of 8, you suspect an MI, or you don't know why they're dead, but they're dead, you should be doing 200 or 2-minute CPR. And that'll be 4 rounds for a total of 800 compressions or 8 minutes. Reassess pulse and breathing, start over. When we're doing the 200 or 2-minute, there's no positive pressure ventilation at all, ever, only passive oxygenation. If your patient is under 8 years old, you should always be doing 30 to 2 one person or 15 to 2 two person, no matter what. But if you're unwilling to put your mouth on the child, then just do the 200 or 2-minute CPR until a family member becomes available or some kind of airway adjunct, then immediately switch to 30 to 2 one person or 15 to 2 two person.
Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it.
Right.
Okay, well,
If your patient is over the age of 8 and you know why they're dead, and you have a single rescuer, you should be doing 30 to 2. If it's a child over the age of 8 and you have 2 rescuers, you should be doing 15 to 2. When in doubt, do 200 compression CPR. So if it's been a while since you've done CPR, your adrenaline's up and you're kind of lost because Mark told you 15 to 2, 30 to 2, 200, 2 minutes, and you're lost, you should always default to 200 compression CPR. There's nothing that says you can't switch from one kind of CPR to the other. A lot of you watching this work in doctors' offices. So this scenario is going to be based on a primary care physician's office where you have a 65-year-old male who walks in for a checkup with the doctor. Your patient is 65-year-old Mr. Smith, and you walk him back to exam room 2, where you take his vital signs and you find nothing significant. You tell him the doctor's running a little behind and it's going to be about 10 minutes before he or she comes in. It's been 15 minutes and the doctor has not seen the patient. So you go in the exam room and you find Mr. Smith with his head up against the wall, sitting in a chair, taking snoring respirations. You yell at him, "Mr. Smith, wake up." There's no change. So you put your hand on Mr. Smith's shoulder and you shake him and you yell a little louder, "Mr. Smith, wake up." Still no change. That doesn't mean he's dead, but most people would have woken up with that. So open your door, yell out, "Somebody call 911, get an AED, I need help in room 2. So you have the ball rolling. We need to get Mr. Smith to the ground. So it really doesn't matter how you get him to the ground. The best thing to do would be avoid hitting his head against any kind of hard object that would cause a head bleed that he didn't have before. Another consideration once you get him to the ground and supine, which is on his back, is you should be able to walk in uninterrupted circle around him. So if there's a wall in the way, an exam table, a piece of furniture, that's not going to be great. We need to get in a good position where you can do high quality CPR. So if you have to drag him out in the hallway or to another space to do better CPR, that's what you need to do. We're going to be doing 200 compression CPR on Mr. Smith. Why? Because he's over 8, we suspect an MI or a heart attack, or we don't know why he's dead, but he's dead. I'll repeat that. He's over 8, we suspect an MI, or we don't know why he's dead, but he's dead. So that's the 200 or 2-minute CPR for 4 rounds. So ideally, we're going to get 4 people involved in this, and everybody's going to do 200 compression. We'll work in the AED as we can, but we will not defibrillate unless we've finished 200 compressions before the next person starts. If it's just you and one other person, we'll bounce back and forth. You do 200, they do 200. You do 200, they do 200. But ideally you have 4 people involved and everybody's doing 200 compression. At the end of 4 rounds, we'll reassess pulse and breathing. We'll start over.
I know CPR. I took a class where you do chest compressions to a Bee Gees song. How deep is your love? How deep is your love?
Are you sure it wasn't Staying Alive?
2 on the nose.
Again, most of you watching this are healthcare providers, but I'm going to give you a scenario where you're not in a clinical environment. Murphy's Law says that CPR or your pulseless apneic patient will most likely happen when you're not at work and you have no other help. So I'm going to give you a home-based scenario. If you wear scrubs to and from work, your neighbors all see that. So they don't know if you're a vet tech or a doctor or somewhere in between. They have something programmed in their mind where if they ever have an emergency at their house, they're gonna knock on your door. So that's what your scenario is based on. It's 2 a.m. and you hear bam, bam, bam at your front door. You feel it's safe, so you look through your peephole or the window on the side of the door and you look out there and you recognize a neighbor. You don't know him or her by name, but you recognize them as a neighbor, and they're holding a lifeless infant in their arms, screaming, help me, help me. What are you gonna do? My suggestion is if you feel it's safe, you open the door and you activate 911. So as you're carrying that baby, you're looking for signs of life. You walk towards your phone, call 911. Most phones now, you can just start talking out loud, speaker phone. If you only have a cell phone, they're all GPS enabled. Just start talking out loud. Give your address and explain to the operator what's happening. So I'm describing to you an infant. They're under 1. So this baby is still warm and limp. You need to put that baby on the ground, pad behind the shoulder blades, and start CPR. So you have 2 options here. If this mom or dad, whoever handed you this child, is cool, calm, and collected, you can get them to breathe for you. So you would have 2 rescuers. That would be 15 to 2 CPR. 5 times, reassess, start over. Is that likely? Or a mom or dad would be cool, calm, and collected? Most likely not. So if you find yourself by yourself doing CPR on this infant, again, I would not put my mouth on them. So I would be doing 200 compression CPR. Again, pad behind the shoulder blades and start 200 compression CPR. At the end of every 200, you have up to a 10-second break before the next one starts. If you have water or anything else coming from this infant's mouth, before you start your next round of 200, make sure you roll them to their side to clear their airway, put them back on their back, and start over. This next scenario we're going to talk about is you're driving in your vehicle and you're on a long road trip. You're an hour from the last city you visited and you know that it's going to be another hour before you get to the next city you're coming to. The vehicle in front of you veers left, veers right. You see it roll, people are ejected, luggage is ejected, and you decide you're going to stop. So this is what you need to remember in a scenario like this. Is you come first. Everybody else who's around you who's alive comes second. As mean as it sounds, the dead person comes last. It doesn't matter if that dead person is a 1-week-old dead baby or a 150-year-old little old lady, because you have to protect yourself and the people around you first. So don't risk your health for something that's technically already lost. That's what I'm trying to say here. So you pull your vehicle to the side of the road and you're in a safe position. You approach your first patient, all traffic is stopped, and you feel it's safe to enter the roadway. You go out there and you have an adult male who is taking agonal respirations and is pulseless. So you have a couple options here. You could stick with that patient and try and treat them. What kind of CPR would we do? They're over 8 and I know why they're dead. That's 30 to 2, 1 or 2 person for adult. But we talked about it earlier, the likelihood of you carrying a pocket mask or bag valve mask with you 24/7, 365 is slim to none. So what should you always default to? 200 compression CPR. So pull this person to a safe area and start 200 compression CPR. So in this particular scenario, I would walk past this patient and check the vehicle first. I would check to see if there's any small children or any other adults that might need my help who are not already pulseless and apneic. If you don't find that in this particular situation, then come back to the victim who you found earlier and treat them. What kind of CPR are we going to do? This adult is over the age of 8 and you know why they're dead. This is trauma. So they should be 30 to 2, 1 to 2 person, 5 rounds, reassess, start over. But the likelihood of you having a pocket mask or bag valve mask is slim to none. So you would always default to 200 compression CPR. If you feel like where you're at in the road is not a safe position, then move them somewhere else. We don't care about broken necks or broken backs. They're already dead. I can't make them any more dead than they already are. So pull them into a position where it's safe for you to do CPR. So first we're going to talk about the BVM, or bag valve mask. These come in a big bag. You'll pull them apart, place your mask up here, plug in your oxygen supply tubing, connect this to the oxygen tank, turning to 15 liters, and that's the same no matter what bag valve mask you have. It will always hook up to 15 liters. Next is the AED. Saying AED is like saying car. There's several different kinds of AEDs. This is just a trainer. The most buttons an AED has is 2, on and shock. Many AEDs now have 1, where it has a lid, and when you open the lid, it turns on itself and the pads are already plugged in. But I'm gonna show you worst case scenario. You have 2 buttons and you have to plug your pads in. So you turn them on and they all talk out loud.
Apply pads to patient's bare chest.
It wants me to plug in the pads.
Connector next to flat.
So I'm gonna do that and turn the volume down so you can hear me. It will not let you move forward until you do what it's asking to do. So plug it in. These stickers tell you exactly where to go. This wants you to go lower left and upper right, bare skin. We showed you earlier, infants and children are center of the chest and center of the back. I'm gonna turn it off moving forward so you can hear me. This is a pocket mask. So a lot of times you need to push it out. It has a one-way valve on it right here. And then the point is always the nose. This particular one even has a label on it here that says nose. You might not be able to see that. The bottom says chin. So when you put this against the patient's face, your hand will make a C and you'll press straight down and you'll put your mouth here and blow in. So we're just gonna talk about moving a patient from the couch or a bed or an exam table. It's really no different to the ground. We're not worried about, I know this sounds bad, breaking an arm, breaking a leg. If they're dead, they're dead. We need to get them on the ground and start high quality CPR sooner than later. So again, we've already confirmed that this patient is pulseless and apneic. We said, hey, call 911, get an AED, and now I need to move him down here to the ground. So if you're by yourself, my suggestion is you scoop behind their head, grab them by their hips, and bring them to the edge, and flop their hips onto the ground and ease their head to the ground. So what that allowed me to do was keep their head from smacking the ground or any kind of hard surface, so we didn't cause any kind of head bleed that we didn't have before. So we should treat this person as if they're sleeping. What would it take to wake up the sleeping person? A lot of us, we can just raise our voice. Mr. Smith, wake up. There's no response. That doesn't mean he's dead, but we just want to come down, maybe put our hands on him and shake him. Mr. Smith, wake up. No response. Some people can sleep through a train coming through their house. So now I get to cause a little bit of pain to this person. So if you don't like them, this is where it gets fun. In the medical world, what we do is a sternal rub. So you put your knuckles down on their sternum, male or female, and rub up and down. And what you're looking for is for them to grimace, pull away, or open their eyes and go, what are you doing? If there's no response there, it just means there's no painful stimuli. This is where we yell out, somebody call 911 and get an AED. So we've activated 911. Now I need to find out if this person's dead. So what we do, we come next to them and we check for a carotid pulse, 2 fingers. Some techs might tell you to use 1 finger. I'm going to tell you to use 2. And you're not pressing in, you're pressing flat against their neck for 10 seconds. 10 seconds is going to seem like a really long time because your adrenaline is up. Something's wrong with this person and you just activated 911. So you have 2 options here, great pulse or no pulse, nothing in between. So next we need to check for breathing. We're just going to look at their mouth. I don't have to put my face down next to their face. I'm just looking for a normal breath. If it is not a normal breath, that is called an agonal respiration. What that can look like is a fish out of water, somebody's gasping, so they're just inhaling, just exhaling. The whole point is that is not normal. That's not how we breathe. It should be consistently in, out, or if you're left-handed, you breathe out, in. You guys are backwards. So we've confirmed they're pulseless and apneic, not breathing. It's time to start doing CPR. So we're gonna go nipple line, center of the chest. Put your dominant hand down first. Your thigh should be touching their torso. I'm right-handed, so my right hand goes down first. My left hand goes on top for balance. My elbows are not unlocked, they're locked. And I'm gonna lean over as far as I can. I want the center of my chest over the center of their chest. And I'm gonna press hard, deep, and fast. And if I'm doing 200 compression CPR here, It should last about 2 minutes at a rate of 100 to no more than 120 per minute. So the days of 2 inches or half the depth of the chest, we don't do that anymore. Make the sternum touch the spine. Who's ever doing the first set of compressions should feel crack, crack, pop, pop. Yes, you're breaking ribs, but broken ribs are better than being dead. So here is what 200 compression CPR rate would look like. So obviously that wasn't 200 compressions, but that's about the rate we're gonna go. Next, moving forward, we're gonna talk about the AED, automatic external defibrillator, shocky thing, if you can't remember the other things. So we're gonna work in the AED on this CPR mannequin. So what I want you to picture is 2 people here doing CPR. One person is where I am right now doing CPR. In this scenario, what you saw me doing earlier was 200 compression CPR. So just picture a rescuer here doing CPR. But for this video's sake, I'm gonna be doing it by myself. So you have a ghost rescuer here doing CPR, and I now become the second rescuer. So I'm gonna come up with my AED and put the pads on. Remember, these are giant stickers and they go on bare skin. So I'm gonna go around the person doing CPR, under the shirt. I am not interrupting CPR for the AED. So one pad goes there, next pad goes down here, again, bare skin. Person's still doing CPR here, and we're gonna turn the AED on.
Analyzing heart rhythm.
We are still doing CPR.
Do not touch the patient.
Stop. If you're at 100, wherever you are, stop.
Shock advised.
It wants to shock. We have not finished our 200. I want you to go down and finish your 200. Finish your 200 before you hit the shock button. Let it sit here and be annoying and say press the shock button. It's okay. Go down, finish your 200 before the next person starts their 200. Everybody's clear.
Now.
Hit the shock button.
Shock delivered.
Next person starts their 200. We're gonna do this 4 times. This stays on. Just like this. It's gonna stay on. The person goes right back to doing 200 compressions. If this wants to shock and you have not finished 200, I cannot stress to you enough, finish your 200 before you hit the shock button. So continuing, we have the ghost rescuer here. The AED is on, and this person is doing chest compressions. If you were doing 30 to 2 or 15 to 2, you would need a bag valve mask. This is hooked up to 15 liters of oxygen, and this is your oxygen reservoir here. This is the nose at the top, this is the chin at the bottom, and we're gonna use a C method. So again, this is for 30 to 2 or 15 to 2 CPR. So we're across the mannequin's face, and we're pressing down firm against there, so when I squeeze the bag, I don't hear any air escaping around the seal of the mask. And I do that twice, do it quickly. Believe it or not, they call those princess puffs now. So you saw me do 2 puffs, I'm gonna show you what not to do here. What we don't wanna do here is this. We don't wanna be aggressive and fast. It's just a quick, slow breath, just enough to see a little bit of rise and fall in the chest, twice. Set it down, move to your compressions. If we're doing 30 to 2 or 15 to 2, we do that 5 times, which takes about 2 minutes. So next we're gonna talk about the walking, talking child. So what I'm trying to describe is a child who's over the age of 1 and they walk and talk on a regular basis. Once you confirm they're pulseless and apneic, it's no different than an adult. You need to yell out, somebody call 911, get an AED. What I don't want to see somebody doing is what a lot of videos will teach you, is to put one hand down and do compressions on this child. You're not doing CPR on a regular basis, and that's not a normal position. So even if this is a 2 or 3-year-old, I got big old hands, I'm gonna tell you, put those big old hands in the center of their chest and break every rib in their chest if that's what it takes. It's all about the quality of CPR. So get in the same position. Put that hand down there, Again, we're talking about a walking, talking child, and do your compressions. If they're under 8, our numbers are 30 to 2 one person or 15 to 2 two person. The second rescuer is just kneeled up here. They can, if it's a parent, brother, sister, they can put their mouth on them, or you can use your bag valve mask. And we're going 30 to 2, 5 times, reassess, start over. That's single rescuer. So lastly, we want to talk about infant CPR. So this is any child under the age of 1. If I'm by myself, my number's 30 to 2, 5 times, reassess, start over. If we have a second rescuer, it's 15 to 2, 5 times, reassess, start over. If this is not your child and there's no family member around and nothing to protect yourself from bodily substance isolation, then you're going to default to 200 compression CPR here, which means you'll never put your mouth on them. So I'm not going to walk into this situation and ask this infant, are you okay? Like I would an adult. I'm looking for signs of life. If this child is blue, purple, or any color other than normal, lifeless, limp, none of those are viable with life. So what we need to do is we need to come up and check their pulse. So the way we're doing that on an infant is we're checking for brachial pulse for 10 seconds on either side. Again, 10 seconds will seem like a long time. There's no pulse. Now, I'm just looking at the mouth. Normal breath, not a normal breath. Same way we described it earlier. So, if I have a BVM, bag valve mask, or pocket mask, and this is not my child, I'm going to be doing 30 to 2. So I'm going to get in front of the child just like this. My knees are wide. I'm getting a good base. I'm coming across. My hands are wrapped around the back. And I'm going to use 2 thumbs to do CPR. I'm by myself. My number is 30 to 2. I would do my 30. At the end of my 30, I use the bag valve mask, pull the head back, C method, 2 quick breaths, return to my 30, and I'm going to do this 5 times. At the end of 5 times of 30 to 2, I'm going to reassess pulse for 10 seconds, reassess breathing. If they're still pulseless and apneic, I'm going to continue my 30 to 2. If I have a second rescuer, they will kneel here, they will do airway, and I will stay on compressions, and we will switch to 15 to 2. So again, we're gonna have a ghost rescuer here doing the compressions. What we need to coordinate here with the second rescuer is how to place the AED pads on an infant, because children and infant, the pads go center of the chest and center of the back. When somebody's here doing compressions, that person is in the way. So these pads always go on bare skin, so we would need to expose the child. As soon as that person's done with their 30 or 15, we're going to peel the backs of the pads off. We're going to go center of the chest, center of the back with the stickers, roll them back down, continue CPR over the top of the pad. It's no different than the adult. When we turn this on, it sounds the same, and we will not shock if we haven't finished our compressions. I want you to finish your 30 to 2 or 15 to 2 5 times before you hit the shock button. So let's review. We have 3 categories: infants, children, and adults. Infants are under 1, children greater than 1 but not yet through puberty, and adults are puberty on up. We describe it this way because our 13, 14, and 15-year-olds look like they're 18, 19, and 20. We want to treat them as if they look. 1 rescuer across the board is 30 compressions to 2 breaths, 5 times, reassess, start over. If you have 2 rescuers and you're working an infant or a child, you're going to do 15 compressions to 2 breaths, 5 times, reassess, start over. But if you're a medical provider and you're watching this, you do continuous chest compression. If your patient is over the age of 8, you suspect a heart attack, or you don't know why they're dead, but they're dead. If you're in hospital, you'll be doing 2-minute intervals. If you're outside of a hospital, you'll be doing 200 compressions. 4 rounds for a total of 800 compressions or 8 minutes. No positive pressure ventilation at all ever, only passive oxygenation when available. Your continuous chest compression rate is at least 100, but no more than 120 per minute. If the infant or child is not your child and you're unwilling to put your mouth on them, I want you to do 200 compression CPR until a family member becomes available or some kind of airway barrier device like a BVM or pocket mask. Then immediately stop and switch to 30 to 2-1 rescuer or 15 to 2-2 rescuer. If you're lost and you have no idea what to do, your mind is foggy, and you have somebody who's pulseless and apneic, I want you to immediately start 200 compression CPR. When your mind clears up and you realize what you should be doing, if you need to switch to 30 to 2 or 15 to 2, do it then. If you have a bag valve mask, you need to hook it up to 15 liters of oxygen when available. When the infant is flat on the floor, always pad behind their shoulder blades, not behind their neck and not behind the head. Print your name and date on top of the CME form that's provided with this course and save it with your other continuing education forms. I hope you found this useful. Remember to recertify every 2 years. Thank you for watching.